joining us today, and we're here with Laurel Joliff, who is a somewhat of a Medicare expert as far as we've seen through the years. And we wanted to just talk to her about Medicare and sort of entry-level Medicare issues that you might encounter as you come up to Medicare age, or someone you love and care about comes up to Medicare age. So why don't you introduce yourself, Laurel, and tell us how long have you been in this industry?
Okay, so I have had my life and health license for the state of California and a few other states.
Okay.
Since '08.
Oh,
so,
okay.
I think that's 13 years last time I checked,
Yep.
12 years, something like that, I don't know. So I've dabbled a little bit in different kinds of insurance, and I've just found my passion to be Medicare.
Okay.
I found that Medicare folks that are on Medicare need help. It's an incredibly confusing process, and I see that, and so I just I wanted to fill a void.
Okay.
And I felt that there was a very large void here in our area.
Okay.
And so that kind of was a natural fit for me.
Okay.
I mean, I enjoy seniors. I'm getting close to that age, so it's hard for me to call them seniors. But yeah, I thoroughly enjoy them, and I'm of help. They appreciate me, and of course we all want to be appreciated.
Absolutely, absolutely. So as far as Medicare goes, it seems like that it can be confusing on many different levels, not just getting into it, but once you're into it. And my understanding is that you take care of people all the way through the process? Okay.
Well, I do, to an extent. I do as much as I can.
Yes.
For example, a gentleman called me yesterday and said, "Hey, I'm turning 65 soon, so what do I do?"
Mm-hmm.
And so I said, "Okay, I need to ask you a few questions."
Okay.
And I said, "So when do you turn 65? And he said, "October." And I went,
Okay.
"Got lots of time." Got lots of time. But I told him what to expect.
All right.
And
okay.
so the other questions I asked, I said, have you been an employee most of your life, or an employer?
Okay.
Because Medicare handles that slightly different. It's not that big of a deal, but it is a bit of a difference. And he has been an employer most of his life.
Oh, okay.
And so when you're an employee, you're paying into the Social Security system. It's coming out of payroll. You're not even missing the money.
Mm-hmm.
Well, that's more of a natural thing.
Okay.
And you usually get your card about 4 months prior to turning 65 automatically.
So they just send it out to you?
Yes.
Okay.
Yeah. The
All right.
recipient does nothing.
Okay.
They all of a sudden get their Medicare card and realize they're going to be 65, and they go, "Oh my goodness.
Yeah.
I'm
How
gonna
did
be
this
65.
get here?
How did this happen?" And so that's an easy one.
Okay.
Another easy one is if someone's drawing Social Security as income.
All right.
They're already in the system. They'll get it 4 months prior to 65.
Oh, okay.
That's an easy breezy one.
okay.
If you're an employer or been self-employed
Self-employed.
most of your life, for example, those of us business owners, we pay quarterly taxes.
Yes.
And so our Social Security, payments are made quarterly. And so they're paid, but the system is slightly different. And so
Yes.
sometimes those of us who are self-employed have to jiggle the system a little bit.
Okay.
And so what that means, and what I told this gentleman, I said, if you don't have your Medicare card automatically by June,
Okay.
because 4 months prior,
All right.
then in August, I want you to go to ssa.gov
Okay.
and wiggle their button.
Okay.
And
So what does that mean, wiggle their button?
Well, it just means, yes, I want to apply for Part B.
Okay. All right.
Part A comes automatically. Part B, one has to decline it, otherwise you get it.
Okay. So that was a question I was going to ask you a little bit later. I look at it as alphabet soup of
Right.
Medicare.
Right.
And how do people deal with the A, B, C, D?
It's crazy.
E, F. I
You would
think
think that
it's
the
called
federal
F,
government,
yeah.
you'd think that the federal government would have designed a little bit better program, but they didn't. I think we're trying to make it easy, and they didn't.
Okay.
So it's ridiculously confusing. So in a nutshell, Part A is free for most people.
Okay.
And Part A covers hospitals and a few
Yes.
other things, like skilled nursing and a few other things.
But only skilled nursing for a little while.
A little while, 100
Yeah.
days,
Yes.
And so then there's Part B, which is doctors and a few other things like
Okay.
lab work and things like that. Part B for most people is $148.50 a month
Okay.
this year.
This year.
This year. That means it can go up, and it usually
Okay.
does a little bit every year.
And so is that part of the amount that's taken out when you retire from your taxes?
Yes,
Okay,
from
like
your Social Security. Yes.
Okay.
Yeah, so if someone is not drawing Social Security, they make sure they take it out of your bank automatically.
Okay. All right.
They want their money. And so yes, for someone who is drawing Social Security, that $148.50 comes out of their Social Security check automatically.
Okay.
If they are high income earners, and there's a threshold for that, and it's in the
Okay.
Medicare and U book, then they're going to pay what's called IRMA. They're going to meet IRMA.
Okay.
And IRMA is an acronym. Don't ask me what it stands for.
Okay.
But it is for those who make over a certain amount.
Okay.
And the income that they use is 2 years ago's income. More confusion.
Oh.
And so sometimes a wage earner, is making decent money, real good money, and then they retire and now they're on Medicare. Well, Medicare says, well, 2 years ago when you were still working,
Okay.
your household income was much higher. And so this year you get to meet IRMA.
Oh. Okay.
Next year we'll reevaluate and then look at
2 years
2020's
prior.
income.
So it's constantly rolling
Constantly
forward.
changing, yes.
Okay.
Yes.
Okay.
So
Okay.
so that's how Part B works.
Yes.
So you're going to pay for it monthly, and then both of those cover roughly 80%
Okay.
of your bills. And then where I come in is I help with a supplement that supplements Medicare.
Yes.
So I help take care of the other 20% that Medicare doesn't cover.
A lot of people refer to that as gap insurance.
Well, they have two options. Most people, of course, if you're in Calaveras and Tuolumne, it's different because we're special.
Yes.
And so most other counties, if you live in other counties, you have an option of Medicare Advantage
Okay.
or a supplement plan, also known as Medigap.
Okay.
plans. Because we're in Calaveras or Tuolumne, we don't have that Medicare Advantage option.
Okay.
And so yes, the supplement is the only option for them,
All right.
but there are many of those to choose from.
Because they're facilitated by actual health insurance companies.
They are.
Yes.
They are. And some plans, like the G plan, covers a lot more than an N plan.
Okay.
And that's where I come in. And when I sit down with someone, I do what I call a Medicare 101.
Okay.
It's a good
Okay.
hour long, and I go over what A is in detail, I go over what B is in detail, and then what all of their options are.
Okay.
And so when they do make the decision as to which one they want to use to supplement Medicare, they feel a lot better about it.
And they don't have to actually supplement if they don't choose
Correct,
to.
correct.
But they do have to supplement the prescription part
So
of it.
the Part D, otherwise known as a prescription plan, is a voluntary plan that they're penalized if they don't have.
Yes. So we're jumping around a little bit.
We are a lot. We are.
So as far as the D plan, if you don't take it when you're 65, and then, because a lot of people, they go, I don't have any prescriptions. Why should I
Right.
pay for
Right.
prescription coverage?
Right.
But when you take it, let's say 5 years down the road, you have a couple more prescriptions, you want them covered. What happens then when they choose to take that coverage?
Great question. So let's say someone goes 5 years, as your scenario did, without having a drug plan because they just don't take them. They don't see a reason to have it. No one told them about the penalty, which is often the case. Well, they're going to pay at least 60 months of penalty because that's 5 years.
Okay.
Because they're going to pay a penalty for every month they could have had one but didn't.
So it's every single month. It's not annually.
It's monthly.
monthly.
But more
Okay.
importantly, they're going to pay that penalty for the rest of their life.
Yes.
That's massive.
Yes. So it's not just 60 months.
Correct.
It
No, it's
is
60 months every
plus.
month. You're going to
60
pay that
months.
penalty
Oh, okay.
every month for the rest of your life.
So it's the total 5-year penalty
Yes.
for not joining
Getting a
your
drug
D
plan. Yes.
D for drugs.
Yes.
Remember that, D for drugs.
That's right.
They will pay that for the rest of their life.
Correct.
So if it's a year penalty, they'll pay. If it's
12
a year,
months.
they'll pay 12 months.
worth of penalty. Now, here's the other tricky part about the Part D. You can only get a Part D between October 15th and December 7th only, unless you're brand new to Medicare. Then it's a special election.
Oh,
So that
okay.
means if in June you say, you know what, I'm starting to take prescriptions, I better get that Part D plan. Can't get it.
So you have to wait.
You have to
then.
wait until the
Oh.
October, which means we've signed you up for one in October, but it won't start until January. So there's 6 more months of penalty between June and December.
Oh, wow. Okay.
So we can't even write your application until October 15th.
Okay.
Because
okay. So those are the open, what they call the open enrollment periods.
Annual election period, correct.
Okay.
Yeah.
Okay.
Yep.
So if you don't get the D plan
When you're first
when
eligible.
you're first eligible, then either you need to make sure you can afford your prescriptions for the rest of your life. This would be my thinking.
Right. Right.
Or you're going to be penalized for the
Yeah.
rest of your life.
Yeah.
And the thing is you don't really know what your health will be like.
Exactly.
There's the catch-22,
Exactly.
right? You could be
Right.
healthy
Right.
4 or 5 years down the road, maybe
Right.
not so much.
Right.
So
So this year, the least expensive prescription plan is $7.20 a month.
okay, but there's different levels of prescription
There's
plans
32
too.
different plans right
Yeah.
now. And so they range in price anywhere between $7.20 a month and it's about $120 a month, depending on your prescription. Well, when I sit down with someone, we go to Medicare.gov. You can do it
Okay.
yourself. You put in your zip code, your prescriptions, where you want to buy them, how you want to buy them, if you want to go to the store or get them mailed.
Okay.
And then excuse me, Medicare.gov is going to tell you which plan is the best one for you financially.
Okay.
So a lot of people say, oh, I'm turning 65 and my next door neighbor told me that I should get Humana.
Okay.
And I'm like, well, if you're not taking the same drugs, you might have different results. Because, and I don't even know if the neighbor did it correctly in going to Medicare.gov, but let's say they did.
Yes,
Well, unless you're taking the same prescriptions, which you're probably not, the plan might not be the best one for you. You might be
Exactly.
paying way too much, or some of your expensive prescriptions may not even be covered.
Yes. And that is, and sometimes Medicare doesn't cover prescriptions, period.
Correct.
At all. And
Correct.
then you have to appeal
Yeah.
and
Yes.
do all sorts of fun
Right.
stuff.
Right. Right.
So, as far as the other letters, so to speak, so there's A, B, and D, and what about C?
So these are parts. And
Parts,
so
sorry.
part A is hospital, part
Okay.
B is doctors, and both of those have other things added to that. Part D is prescription, and part C is that Medicare Advantage plan that I was referring to that other counties folks can get,
Okay.
but not in Calaveras and Tuolumne.
So, what does that include, Medicare Advantage?
Part C, a Medicare Advantage plan must include what Medicare covers and a few other things. So,
Okay.
so Medicare Plus, Medicare Advantage, and so it includes A and B, and some of them include a D.
Okay.
And then you have copays and deductibles for items. Now, most Medicare Advantage plans are HMOs
Okay.
or PPOs.
All right.
Some are private fee-for-service plans, and so that's a different way of doing things.
Okay.
But most importantly, an HMO means you have to go to those doctors.
Yes.
If you go outside of that network, you're paying 100%. Whereas the supplements, the Medigap plans,
Yes.
which are also called alphabet soup plans, they're A, B, C, D, F, G, K, L, M, and N. So
Okay.
I think
yeah,
that's what
so
they are.
they've-
Yeah. So those, you can go to any doctor you want nationwide. If a
Oh,
doctor takes
okay.
Medicare, they take you. It doesn't matter if they're AARP, Blue Cross, Blue Shield, Health Net. It doesn't matter the company
Okay.
because the federal government decides what that F or the G or the N cover.
Okay.
Okay. So if doctors pay when they sign on to yes, we will take Medicare. That means yes, we will take Medicare rules.
But they don't all have to sign up for Medicare.
No, they do not.
Okay.
Most doctors do.
Yes. Especially in our areas because we have such a high senior population.
And a
but-
low physician population.
Exactly.
Yeah.
But there are some areas where the hospitals just do not have a contract with Medicare.
Hospitals usually do, but physicians don't.
Okay.
So in our area we have a few physicians that are called concierge,
Okay.
and so they say for $30 a month or $40 a month, you call me, I'll come see you, I'll come to your home, you can come to my office, I'll text you whatever, but make sure you have a hospital plan, because my plan doesn't cover hospital.
Oh,
And so you have to
okay.
do that smartly,
Okay.
but there's a way of doing it for them.
Mm-hmm.
But they get out of the whole Medicare world. Usually physicians do that when they're getting ready to retire and they're getting a little picky
Oh, okay.
about, billing and all of that
Mhm.
stuff that they don't want to do.
Okay. Okay. So, as far as so basically, it sounds like when you explain it that way, if anybody's had any sort of experience with the medical world from the point of view of being a patient, it's kind of the same. You get the doctor's bill, you get the hospital bill, you get the prescription bill, and they're all billed by different people. But with Medicare, if they actually all have contracts with Medicare, then they bill Medicare first.
Right.
And
Well, it
then,
depends. If they have a Medicare Advantage plan, they don't bill Medicare. They bill the Advantage plan.
Okay.
So that's just a
okay.
different way of behaving. But so
Okay.
Medicare Advantage plans work differently.
Okay.
But
So I'm curious as to, obviously Amador has the Advantage, Calaveras and Tuolumne do not. Is it the local Board of Supervisors that decides that? Or is it
I truly don't know that answer.
Okay.
Population has money. It's all money.
Mhm.
Where's the money? I mean, these companies are for profit.
Yes,
They all are. And Amador has two: Kaiser, which is a partial county, not
Yes.
even the whole county, and a United Healthcare plan.
Okay.
And so they don't have a lot to choose from. Both are HMOs.
Okay.
So a lot of people still get the supplement because they want to go to any doctor they want.
Yes.
They don't want to get a referral.
Okay.
That 2 doctors visits. If I want to see a dermatologist, with an HMO, you have to see your primary care first. You pay
Okay.
that copay, and then they refer you to a specialist, which is another month. Whereas if you have a Medigap plan or a Medicare supplement plan, you just call the specialist.
So some people actually then do both of them.
No,
or
they cannot.
choose.
They
Oh,
cannot
they can't
have
do
both.
both. Okay, all right. They can't sort of
they can have a
stack
C
them. Okay.
or a D with a supplement.
Okay. Now, as far as sort of dental care and eye care, that's not covered by Medicare, is
Correct.
it? Okay.
Correct. Some Medicare Advantages in San Joaquin, Stanislaus, Sacramento, and any other place, some of them cover some kind of dental and some optical. Not very
Okay.
much. They're not why you buy the plan for for sure. For example, Stanislaus has one plan that offers a dental plan, but there's one dentist in the whole county that takes it.
Oh,
So
wow.
when I talk to folks there, I say, don't buy this plan for the dental.
Okay.
Because you will not be happy. So
So you're better off just getting your own supplemental plan if you can afford it.
yes,
Okay.
I would say so. I mean, you have much more freedom. You have much more control. If you have the F plan or the G plan, for the G, other than the deductible, you're not even going to get a bill ever because it's 100% covered as long as the procedure is covered by Medicare.
And that's another catch
That's
22.
it is. It's a big deal. It's a big deal.
And you have to get the doctor to approve
Right.
procedures
But
that are
doctors
not
know that.
approved. Yeah.
Yeah, doctors know what's
exactly.
approved and what's not.
Yeah, hopefully.
Yeah, they want to get paid.
That's
You know.
true. That's
Yeah.
true. They're
Yeah,
billing
usually
departments.
they'll say,
know.
well, this isn't covered by Medicare, but I think I'd recommend it. And then
Okay.
you can decide whether you want to do it.
Okay.
So.
Okay. All right. So there's a lot to think about just when you're getting started. So somebody comes in, they're 64. You say, if you don't get the card 4 months before, look at 2 months before your birthday.
Right.
And then
And then
what
you go
happens?
to ssa.gov,
Okay.
and then you sign up for Medicare Part B,
Okay.
and that might take 4 weeks or so,
All right.
but you'll definitely get your card prior to the birthday if you do it right. When you go to ssa.gov, you need to take your time.
Okay.
You're doing usernames and passwords and trick questions and all of that. So you
Yeah.
make sure you write it down. It's not something that you want to do in a hurry.
Okay.
And it's very personal. It's got your social security number in it. So you don't want to use a public computer.
Okay.
You go to someone who you can trust if you don't have one.
Okay.
You don't do it at a coffee shop where there's Wi-Fi that other people
So
can
no
get.
shared Wi-Fi.
Right.
Make sure it's a secure Wi-Fi.
Yeah.
Okay.
It should be someone you trust.
Okay. Okay.
So I would definitely recommend that. If someone is employed,
That was another thing I was going to ask because, nowadays in our culture, in our society, a lot of people are working to
Right.
older ages and they're have insurance from their employer.
They do.
So how does that interact
They
with,
do.
with
So when
Medicare?
that same guy calls me and says, "Hey, I'm turning 65 in October," I say, "Okay, I'm going to give you a list of questions
Okay.
that you're going to take to your HR department and you need answers for. The first question is, do you require me to take Medicare once I become eligible?"
Okay.
That's real important.
All
If they don't
right.
require it, then don't pay. Don't. Then you can decline Part B,
Okay.
and there's no penalty involved.
But you still have to take Part A.
You don't. Well, it's given to you automatically, and
Okay.
it's free.
All right. Okay.
So now you're
Okay.
doubly covered for hospitals.
Okay. Yeah.
Yay.
And hopefully you don't end up in them. But
Right.
Anyway.
Right. But for the employer, if it's some people, I'm jumping around a little bit. So let me go back.
okay.
So the questions that someone's going to ask for the HR.
Okay.
Do you require me to take Medicare when I become eligible? And usually the answer is yes,
Okay.
because that 65-year-old is much more expensive to insure than the 25-year-old. That 65-year-old is racking up all those premiums for the 25-year-old, and the 25-year-old's not liking it.
True.
If the employer can say, no, we require you to take Medicare,
Okay.
and here's our options for your supplemental coverage. And usually that supplemental coverage is very expensive because
Okay.
they want you to go off of the employer plan, so you're
Okay.
not racking up the bill for the 25-year-old.
Okay.
And frankly, it's much less expensive. It's a lot less expensive if you just don't do the employer plan and you go directly to Medicare and the supplement.
So then, likely you have the two choices. You can take your employer's supplemental plan or do the Advantage or Medigap plan.
Correct.
Okay.
Correct.
All
Yeah.
right.
Now, sometimes, and then of course, what do they cost?
Yes.
A lot. This is something that's important. So your whole life, you've worked for a company. They give you a fabulous employer health coverage plan. It beats anything on the market. You want to keep that group plan until you're 65.
Okay. So what is the difference then?
The difference is price. Sometimes
Okay.
you're going to pay double what you paid when you were 60. And again, A is because they want you off of it because you're increasing the price for the 25-year-old. But the big thing for me to make sure that you understand or that others understand is that because that employer plan has been the golden plan your whole life,
Yeah.
and it beats everything hands down, price wise included, you think you earned it, and so you should keep your employer plan.
Oh.
So
okay.
I change people from their employer plan to an individual Medicare plan at least monthly. They're
Oh.
paying $8, $9, $1,000 a month for their Medicare plan because they thought it was the best one for them, because it's always been the best one for them. And now they're paying $200 a month, maybe $250 a month, including Medicare. And so I'd
And
say
it's
you're going to
about-
have a party. You're going to be thrilled. You're going to love me forever because I'm saving you $700 a month.
So it
Crazy.
is it the same coverage though?
It's sometimes better.
Okay.
Sometimes
Okay.
it's better
All
because
right.
the work plan it was an HMO
Yes.
or a PPO, and now they have a Medigap plan that covers everything.
Okay.
They have zero copays, zero deductibles,
Okay.
and so it just depends.
So it's just changing that mindset.
It is.
You
It
know,
is.
when you get to the Medicare
It is.
age,
Right.
that maybe the insurance you had all of your working career,
That's exactly
it's
right.
not quite so
Right.
financially beneficial for
Right.
you anymore.
And
to
now
keep
it might be, but you need to know when you're comparing costs.
Okay.
And so my question is, do you require me to take Medicare when I'm first eligible? Do you offer supplemental plans to my Medicare?
Okay.
How much are they? What do they cover?
Okay.
And if I am the employee, is my spouse still covered? Does my spouse now have to go off if I go off? Sometimes that's a reason why someone would stay on an employer plan.
And that can be a real catch-22, especially if your spouse is younger than you.
Exactly. Exactly. And so,
You know.
and again, I help folks understand the questions so they can make a decision
Okay.
with everything involved.
All right.
Sometimes, I have several folks that go to my church that came to me for help. They said, we're paying, $600 a month each for this health insurance. Can you do something better? And of course, usually I say, well, of course I can. Let's sit down. But my answer is I don't know. Let's see.
Yeah, you need to take a look.
Because employer plans don't have a donut hole, otherwise known as the coverage gap.
Yes.
Individual plans do.
Mm-hmm.
These two couples, because of if it was just medical and health insurance wise, hands down, I could save them $400 a month each.
Mm-hmm.
But when you put their prescriptions in, knowing that they would go to the donut hole,
Yep.
I say keep your employer plan.
So explain
plan.
explain the donut hole for people who have heard the term but just have no idea what it means.
And
because it can be very shocking for people when they fall into it.
So a lot of people just think donut hole, that's expensive. And it's kind of true. They said that they would remove the donut hole, if you will. And the technical term is coverage gap.
Yes, yeah.
But basically, it's when you and the insurance company combined meet a certain number of your prescriptions. Generics don't get you there, the high dollar ones do. Then you go into the coverage gap, and at that point, you're going to pay more for your prescriptions until you reach a certain number, and that's out of your own pocket. And then you go into what's called catastrophic coverage. Not many people get there to the catastrophic phase. I have people, though, get there in January.
It really depends on the prescriptions
But
they're
here's
taking.
the truth.
Yeah.
If someone goes to the catastrophic phase in January, that means that they've spent $6,500 out of their own pocket. But here's what happens, though. Once that happens, they pay 2%, 5% for their prescriptions the rest of the year.
Exactly.
And so they're thrilled because now that $7,000 a month isn't really there.
Yes, exactly.
So that's something. But most people don't even get to the coverage gap. Again, generics don't get you there. The insulins, the more expensive ones do.
So with the prescription plans, the Part Ds, do they have different coverage gaps depending on the
so the numbers that you reach are across the board the same federally.
Okay.
And they change every year.
Okay.
course.
So that kind of begs the question, do a lot of these things change, like elements within Medicare change every year?
A lot changes every year. So your monthly premiums for Medicare changes. Your monthly premiums for all 32 prescription plans change, or close to them. Copays change. Thresholds change for that coverage gap.
Okay.
Everything changes. And so that's why this book is so important.
Which you get every year.
And everyone gets this every year. My mother's the only one I know that's really read it. Really. But there are numbers in there. In fact, you can see my little tabs because I use them a lot for, okay, what's that number? What's that number? What's that number? How do I know if I'm going to meet Irma this year? How do I know if I get extra help? And what extra help is, and that's kind of a good topic to cover. Extra help is when your income is lower, not so low that you qualify for Medi-Cal.
All right.
But extra help is kind of the middle. But then the numbers are in here as far as the thresholds go. If you're single, it's this much. If you're married, it's this much.
So there is a middle.
There is a middle.
There is a middle.
And that middle is called extra help, and it only helps with prescription plans. So it helps with the monthly premium.
All right.
And it helps with the copay.
Okay. But it doesn't help with hospitalization or doctors.
Correct. It's only for prescription plans.
Okay.
Yeah.
Or medical equipment.
Correct. That's under Part B.
All right. Okay. So medical equipment like nebulizers, concentrators.
Yeah. Durable medical equipment.
That's
under
all
Part
under Part B. But sometimes if you have a nebulizer with an ampule, then you can,
and it depends on where you get it.
Exactly.
And so if it's a pharmacy, if you get it at the pharmacy, it's under Part D as in David.
Yes.
But if it's if it's physician administered, it's under Part B.
Okay.
Yeah.
Okay.
So chemotherapy is something that people often ask about Part D, and it depends on where they get that prescription. If it's physician administered, or if
okay.
it's administered in the hospital, it's under Part B, as in boy.
Oh, okay.
If you pick it up at the pharmacy, or it's through the pharmacy mail order program, it's Part D, as in David.
Okay. So if people actually, they're aware of these differences, they can save themselves a little bit of money if they go to their doctor
Right.
and say, can you write it for Part B instead of Part D?
Well, they don't necessarily write it. Physician has to
Has
administer
to
it.
actually administer it.
Yeah.
Okay.
Yeah.
Okay.
Yeah.
All right. So what if someone maybe only works maybe a couple of years in their whole life? Do they qualify for Medicare?
So they don't, unless, but they have an option.
Okay.
So Part A is free for people who've worked 40 quarters in their
Yes.
lifetime, so 10 years.
Yeah.
If you haven't worked 40 quarters, you can still buy Part A, and there's a fee for it.
Okay.
Okay. If you've worked 5 years so then the fee is lessened.
All right.
But you'll always pay it. Some people go get a job when they're 65 to finish those 10 years.
Oh,
you bet.
they do. Okay.
And it's worth it if they can,
Oh, okay. Okay.
because they need to pay into Social Security for 10 years, or
So,
40 quarters.
Okay. So let's say, like at 55, and it doesn't have to be a full-time job, right?
No, not at all.
Okay.
Not
So as long as they're paying in
Into
those
the
quarters.
Social Security system, yeah.
Okay.
Yeah.
So
And actually, to be perfectly honest, I don't know that answer as far as whether or not it's a full-time or a part-time job.
okay. Okay.
That would be
That would
a
be
Social
something.
Security question.
Okay.
Yeah.
To look into.
I will admit that I'm not a Social Security expert, and I'm not even a Medi-Cal expert. I'm
You're
a
just-
Medicare expert.
You're a Medicare expert.
Yeah.
Yeah.
So
Well, Medi-Cal is
Yeah.
kind of a different animal.
totally, which is why I'm
It's
like,
not even kind of.
yeah, it is. It is.
It's a different
I'm
animal.
not a Medi-Cal expert.
Okay.
I can promise you that. I will refer you to someone who is. Yeah, if I can't help, I know people who can.
So what type of person would people who qualify for Medi-Cal kind of go to find out?
If you're in Calaveras, Calaveras County Health and Human
It
Services.
is. Okay, so it's like the government department
It
at
is,
that point.
yes,
Okay.
yes.
Okay.
Yes, and they can guide them. Fortunately, that is a plus of living in a small county, that you can get them on the phone. No, forget it in
Okay.
San Joaquin County.
Oh, okay. So
Yeah, my caseworker doesn't call me back. Well, that's because you're in San Joaquin County.
because there's so many people.
So we're blessed to have a small county in that regard.
Okay.
Yeah, yeah. There's pluses and minuses, and that's definitely a plus. You can get through to a county worker.
That is true. That is
Yeah.
true.
Yeah.
So basically, kind of to recap a little bit, as far as 64 years old, start thinking about it, but don't start to worry about it until
Right.
like 4 months before, if you haven't got your card.
Yeah, yeah. So my husband turned 64 this last year.
Okay.
On his birthday, he received a, "Hi, you're going to be getting Medicare soon. So do you have a supplement in place?" So he started getting calls on his birthday.
Oh, wow.
So every brand new agent out there buys a list from Social Security, or I don't
Okay.
know who they get it from really, because I've never bought it, truthfully. And they know who's turning 64. And they know when you're 64. So that's when people get hounded in their mail. They have tons of junk mail. They have tons of phone calls. In fact, I got a call this morning for him.
Oh.
And I said, well, there's two, not one, but two brokers here in the house. So you can probably take us off your list.
Yeah, exactly.
Yeah, and so I do tell people that. So I tell folks, find someone that you trust
Okay.
and plan on using their expertise. If it's me, wonderful, I'd love to be able to help you. And if it's not, that's okay too.
Okay.
And so that way, when someone calls you, you can say, I already have an agent, take me off your list.
Okay.
And they have to.
Okay,
By law.
so they have to take
They
you
have
off
to
the
take
list.
you off,
Okay.
off their list.
Which makes their life a lot easier.
It does,
as
it
people
does,
are
because
calling.
the calls eventually go away. And then though, when people tell me that, I've got stacks of junk mail, I say keep it, bring it to your first appointment with me,
Okay.
and we'll go over it. Because
Oh.
sometimes it looks official and you don't know.
See, that's the catch-22,
It is.
right?
It totally
that
is. And so I
there's
say,
a
bring your
lot
stack
it
of stuff.
that
We're going to
comes
go through it. We're
Okay.
going to shred this, throw that away, keep that. Shred, throw, if it's got your personal information on it, because some of it does,
through. Yeah.
shred it,
Okay.
Throw that away. Throw that away. I can tell you how junk mails. You can tell if it's junk mail and what's official by these two seals.
Yes.
Center for Medicare and Medicaid and Medicare.
See, this will be on, and that'll
It's
be
on the
on.
on the front page of this book. But that's how you can tell whether or not it's junk.
And it's on all correspondence as
It
well.
is. It has to be.
Yes.
Yeah.
Yeah.
So yeah, I have people bring their junk mail because again, they're afraid of throwing something away that it might be important. Now, something that a lot of people don't know is your Medicare's card is actually going to come in the mail in an unmarked, plain white envelope. It does say Center for Health and Human Services, but a lot of people think it's junk.
So always
And a lot of
open
people
them
throw them away. Open everything.
from 64 on.
Yeah, so 64 and a half.
64 and a half on. Okay.
When someone who's 58 calls me and they say, okay, I'm getting ready, I say, don't
little
worry
too
your little
soon.
head about it. It's all going to change, so don't worry about it. So people are already stressed out. I don't want to stress them out even
Okay.
more. They don't need to worry about what might be at all. But when you're 64, that's when things are starting to come in the mail.
Okay.
And if you're working, I give them that list of questions. And if you're not, so yeah. And so then ultimately we'll set up an appointment, and it's usually a face-to-face. If someone's not comfortable with that because of our COVID time, A, I can wear a mask, or B, we can do a Zoom. I've done a lot of Zooms, and we go over all of your options there.
Okay.
And then you decide what you want to do.
Okay.
And so, but we can do it. People call you and say, well, 6 months before you can sign up. Well, it's true. It's not effective, though, until the month of your birthday.
Okay.
So you're not locking in a rate because it doesn't start until then.
It doesn't
anyway.
start until then anyway. Okay. So A is free.
A is free for most people.
It's sort of free. They're taking the money out of.
You paid for it your entire life.
Okay. Yeah. So A is free.
Yeah.
And then B, you have to sign up for. D, you have to sign. Well, you don't have to sign up for B. Sorry, D, you should sign up for, or else you could be penalized.
Right.
And that should all be done in that 65, right?
I would say 2
before.
months before, 3 months
Okay.
before.
All right. Just so to give people kind of a timeline.
Yeah.
Yeah.
People start worrying about it, and I don't want them to worry about anything more than they need to.
Okay.
I don't do my own taxes. I don't worry about my own taxes because I have a great CPA that does my taxes. I don't worry about it. And so just find a good Medicare agent that you trust. Okay. I'm a broker, by the way, and so that means if it's United Healthcare, AARP, Blue Cross, Blue Shield, HealthNet, IAC, and I can go on because I handle all of them. And so I literally say, here's all the companies, here's the plans, which one works best for you?
Okay.
Which one do you want to do? And let's sign you up.
Now, are there some companies that they don't serve our counties?
For supplements?
Yes.
No.
Okay.
Well.
So supplements, you're okay with?
Oh yeah.
Excuse
Supplements,
me.
yes. And so a supplement, for example, some company, I can't even think of the names of them right now. They're very expensive for their supplements, and so I don't even write them because it's not valuable.
It's not worth it for your clients.
If they're with that company, I know I can save the money.
Oh, okay.
And so I work with the companies that give the best value for the client.
Okay.
So no, I do not work them all because they're not all good for you.
Okay.
Does that make sense?
Yes, absolutely.
Yeah, it's a waste of my time. It's a waste of their time.
Okay.
Yeah.
Okay. All right. Well, we're pretty much wrapped up for this part of, I'd love to talk to you again about sort of go further into Donut Hole, what happens when you're actually taking advantage of the Medicare system and kind of how to work your way through that, because that's a whole different discussion, people, believe me. So, but thank you so much for sitting down and taking the time to talk with me.
I hope this has helped.
Oh, totally. It absolutely has. So
Good.
thank you so much.
Good. But you are very welcome. Thank you so much for having me.
You're welcome.